The following is a COVID-19 update statement by Dr. George Mitchell, National COVID-19 Response Coordinator.
Fellow citizens, good evening. I am Dr. George Mitchell, the National Coordinator for COVID-19. Today, Friday, April 10, 2020, I announce that there are 2 more laboratory-confirmed cases of COVID-19. This brings the total confirmed cases of COVID-19 presently on the island to 13. As we discussed in our press conferences earlier this week, our medical team has commenced a broader range of testing based on our modeling regarding contact tracing and timeline activities for all COVID-19 confirmed cases to date. Also, we now have the ability to conduct testing on the island. So far this week, we have tested 47 persons, of which 45 were negative and 2 positive. Both individuals are associated with one of the cases previously announced. Both individuals are stable. This brings our overall testing total to 92, of which 14 have tested positive. However, only 13 cases are on the island. Let me assure you that all our positive cases and their contacts are under quarantine. We continue to rigorously enforce and enhance our quarantine and isolation measures, and the RGPF has been a diligent partner in ensuring that all the guidelines are observed. We urge the public to inform the Ministry of Health or the nearest health facility of any individuals who are displaying acute respiratory symptoms. If you believe you are exhibiting symptoms of the virus, do not leave your house. Do not take public transportation. Do not go to any hospital or medical facility. Call the health hotline at 538-4787 or 458-4787. I remind you to please observe the curfew. Please stay inside unless there is a medical or food emergency or you are an essential worker. I urge you to wash your hands and to practice good hygiene. Wear a mask or cover your face when in public as much as possible. In closing, I would like to express gratitude to all frontline workers, including our medical professionals and the Royal Grenada Police Force, for their selfless and timely service in helping to protect Grenada, Carriacou, and Petit Martinique from this deadly disease. Let us all work together to prevent community spread and to ensure that our country wins the battle against COVID-19. I thank you.
The preceding was a COVID-19 update statement by Dr. George Mitchell, National COVID-19 Response Coordinator.
The COVID-19 pandemic is causing untold human suffering and economic devastation around the world. I recently called for an immediate global ceasefire to focus on our shared struggle to overcome the pandemic. I appealed for an end to violence everywhere now. But violence is not confined to the battlefield. For many women and girls, the threat looms largest where they should be safest, in their own homes. And so I make a new appeal today for peace at home and in homes around the world. We know lockdowns and quarantines are essential to suppressing COVID-19, but they can trap women with abusive partners. Over the past weeks, as economic and social pressures and fear have grown, we have seen a horrifying global surge in domestic violence. In some countries, the number of women calling support services has doubled. Meanwhile, healthcare providers and police are overwhelmed and understaffed. Local support groups are paralyzed or short of funds. Some domestic violence shelters are closed, others are full. I urge all governments to make the prevention and redress of violence against women a key part of their national response plans for COVID-19. That means increasing investment in online services and civil society organizations, making sure judicial systems continue to prosecute abusers, setting up emergency warning systems in pharmacies and groceries, declaring shelters as essential services, and creating safe ways for women to seek support without alerting their abusers. Women's rights and freedoms are essential to strong, resilient societies. Together we can and must prevent violence everywhere, from war zones to people's homes, as we work to beat COVID-19.